Oh, I don't need that either. I don't feel
She's got my scowl. Oh, is it working? Yeah. Okay. Ready? All right, everyone, we'll get started. I was going to get introduced by Denise, our clinic manager, but she said everybody knows me already, and you can always recognize me by the gigantic picture up here. So we'll go ahead and get started. Thanks all for coming. So yeah, I titled this While You Were Sleeping. This is not an endorsement of the 1995 film starring Sandra Bullock. I've never seen it. I don't have any plans to, except my wife told me that we have to watch that tonight since I titled it this way. So yeah, in this presentation we'll talk a little bit about basically what is sleep, kind of what is your brain doing while you sleep, some statistics on sleep, and at the end hopefully we'll get some tips that everybody can walk away with and hopefully use to get some better sleep. I don't want to promise any magic bullets or any magic pill that's going to, if you're getting up 10 times a night right now, to be able to sleep through the night just from hearing this presentation. So we'll set the expectation that way. But the other thing I want to say is if anybody does fall asleep, your bellies are filled now, so if you fall asleep during this presentation, I will actually take that as an honor if you're listening so well to me today. So, alrighty. So, what is sleep? So we all kind of know what sleep is without really thinking about it. It's kind of one of those things where we recognize it without having to define it. But here's the definition. So it's a condition of the body and mind that typically recurs for several hours each night in which the eyes are closed, the postural muscles are relaxed, the activity of the brain is altered. Notice I didn't say sleeping or deadened, but altered. And consciousness of the surroundings is practically suspended. So now I don't know if I've ever seen a cuter picture of anybody sleeping, but that is my daughter, and our dog there. So you can tell she's sleeping. So, all right. So I do want some audience participation here today. Maybe that'll keep you from falling asleep. So, which animal sleeps the longest? So we got 4 options, multiple choice. So we have a sloth. A is a sloth, B, basset hound, C, koala, and D, brown bat. So everybody has to raise their hand for one of these choices. You can't choose all of them, and you can't choose none. So who says sloth sleeps the longest? Okay, we got a few sloths. How about basset hound? A couple people say basset hound. How about the koala bear? Okay, a little more of that. And the bat? Who says the bat? Okay, I think the bat wins. It is the bat. Brown bat sleeps the longest. Kind of cheating when they have the whole day to sleep. But how long do you think the bat sleeps for in 24 hours? Anybody shout out an answer? 20 hours? What else did I hear? 13 hours? Okay. It's 19 hours a day. So really only awake for about 5.
That's too long.
All right. So another question that is common is how much should we sleep? Now I think usually we ask this in the wrong way. We say how little of sleep do I need to get through the day and function? That's probably the wrong question to ask, and we'll get to a little bit why, but this chart over here shows about what is recommended per age. As we all know, infants sleep the most. Unfortunately for new parents, it's not uninterrupted sleep. But then you need less and less as you get older until teenagers are about 8 to 10 hours per night. And then adults, it says 7 or more hours here. Now this only goes up to 60 years, so if you're over 60, I guess you're off the charts. So typically it tends to get less after age 62. Now that's for recommended sleep. I would actually kind of disagree with this chart. I think as adults, shooting for 8 hours is probably what is actually recommended. So 7.5 maybe minimum. And we can talk a little bit more about why that is. So then, yeah, over 60, people tend to say, oh, you don't need as much sleep as when you get older. Is that true? Well, yes and no. The answer is yes, in the sense of it's normal. That's many people do struggle getting to sleep or staying asleep as they get older. To the point where some people say, well, 5 hours is normal for if you're over 80 or something like that. But just because it is common does not mean it is good necessarily. So it probably would still be the same recommendation, about 7 to 8 hours of sleep a night as you get older. The issue is there's a lot of factors that can make it hard to stay asleep and make it hard to get asleep. So some of that is fixable, some of it maybe is not. We'll get into that a little bit too in a little bit. So yeah, it's normal but not necessarily good. But I also don't want you to beat yourself up if you're not getting that much sleep. There might be something that's fixable, but it might be just what we haven't been able to figure out yet. So all I'm going to do is poll. Let me go back. So another raising of hands. Who here gets more than 8 hours of sleep a night?
Sometimes.
On average.
Sometimes.
Okay. So a few people. How about 7 to 8? How many would fall in that recommendation?
I get a good 7.
Okay, that's a few people. How about 6 to 7? Yeah, maybe a few more people. How about less than 6? Does anybody here average less than 6?
Sometimes.
Less than 5? Sometimes, yeah. Okay. Well, hopefully everybody can take something away from this. Okay, so some statistics of Americans. Americans are kind of bad at sleeping. So 70 million Americans have chronic sleep problems. That equates to about 20% of the country, so about 1 in 5 people. 1 in 3 U.S. adults regularly don't get enough sleep, and insufficient sleep is experienced by about 30% of the general population over 18, and 88% of American adults reportedly lose sleep due to binge watching. So I have 2 things to say about these statistics. One is they're actually kind of old statistics now. And these are 2016 to 2019, so 5 to 8 years ago. So I'm guessing it's probably worse now than it was then. 2, if you are one of the people in the 4th line there with the binge watching, you need to go back onto Facebook and watch my presentation from last year on the screen. How those aren't good for you. So. All right, so actually there's a National Sleep Foundation does a poll every year called Sleep in America. This was from the 2020 poll, basically the health impacts of feeling sleepy. So you can see, I'll have the laser pointer here. You can see, so the 3 different things that they were measuring: irritability, headache, and feeling unwell, and that's what the different colors are. So irritability is the blue, headaches are the orange, and then feeling unwell is the gray. So you can see with the 0 to 1 days, not uncommon to have those symptoms. The 2 to 4 days a week of having poor sleep, a lot more common. And then if you have 5 to 7 days a week of poor sleep, about 50% of people, 40 to 50% of people are having those symptoms. So clearly sleep is affecting how people feel when they're awake. Mental health is another big topic these days, hot topic in our culture to talk about. The 2020, more of the recent polls have talked about mental health, so 2023 talked about it in general for Americans. 2024's poll talked about in teens and what's it doing to teens. So about 8 out of 10 teenagers get adequate sleep, is what this poll said. And also the people who get less good sleep have increased depressive symptoms and increased loneliness. So, I don't think there's anything that's revolutionary about what I'm saying right now. Everybody knows when you sleep better, you feel better, and you overall. Interestingly, there was another poll that they did for the 2024 presidential election to see how many people were had their sleep negatively affected by the election. And actually, it said 17.2% of people in this poll said it was negatively impacted. So again, about almost 20%, almost 1 in 5 people. Hopefully you're sleeping better now that it's over. All right, so I mentioned earlier, our brain isn't sleeping in the same way that we think of what our bodies are doing, where our bodies are comatose, we're not doing anything. Our brains are actually quite active when we sleep. So what is it doing? This is a chart of essentially what your brain does in the different stages of sleep. So we call it the sleep cycle. So you have mainly two different kinds of sleep. There's subdivisions of it. So REM sleep, or rapid eye movement sleep, and then non-REM or non-rapid eye movement sleep. And then the NREM has different stages, stage 1, 2, 3, and 4. I guess sleep scientists are really clever with their names. So basically they're named because during rapid eye movement sleep you have your eyes going back and forth, and then you don't in the non-REM sleep. But basically each cycle is about 90 minutes, where you go from either being awake, stage 1, stage 2, stage 3, stage 4, and then to REM sleep, and then back up the way you came. It's about 90 minutes for each cycle. You can see the dotted lines are picturing about every 90 minutes, 11 to 12:30 to 2 to 3:30 to 5-ish, give or take some. The other thing I want to point out with this chart is when you're having which type of sleep. So early cycles, you have mostly this non-REM sleep. So it's a lot longer time down here, and it gets shorter as time goes on. Later in the night, you're having, or as time goes on, the REM sleep gets longer and longer and longer. So we'll talk about the importance of that right here in just a minute too. So the non-REM sleep. Again, I said your brain is actually doing a lot while you're sleeping. So one of the main things that happens during the non-REM sleep is called lymphatic drainage. We all probably heard of the lymph system. Lymph is one of the fluid shifting systems in your body, and it gets rid of a lot of toxins and things like that. Well, the lymph system is the same thing but in your brain, or a similar thing but in your brain. So the lymph system, as you're sleeping, there's almost a pulsing with those waves that are happening with the non-REM sleep. Your brain is pulsating, and it's basically pumping out all the toxins, all the waste products from the day, all the stresses that you put your brain under from thinking too hard, and what we eat and all the air we breathe in, all those things. The brain is pumping those out, so it's clearing all these toxins. This is really important because if you're not sleeping, or you're not getting the NREM sleep, well, then those things are building up in your brain over time. And actually, there's a lot of association with Alzheimer's. They talk about the proteins that get built up in the brain that lead to Alzheimer's, and so that is hugely important for that. The other main thing that it does is working on your memories. So during non-REM sleep, I like to think of it as two different buckets in the brain. You have your short-term bucket, your short-term memory bucket, and all the things that happen during the day. All the things I'm telling you now will go in your short-term bucket for today. And then when you're in NREM sleep, that gets dumped into your long-term bucket. Kind of the same type of thing. You think of it as the pulsing. It pulls it from there, pulls it into there, empties that bucket, fills your long-term memories. So yeah, converts your short-term memory to your long-term memory. And this is actually both for the night before or the night after. So if you sleep well the night before this presentation, you have a better capacity to remember all the things that I'm saying now. If you don't, then maybe not so much. But also the night after. So when you sleep the night after, it does a better job of basically filing those things in the long-term memory bucket. So you can sleep both night before and after can be helpful. And actually, interestingly, even short naps will help with this. So if you take a 20-minute nap after this presentation, your brain is going to do the same thing. It's going to dump some of that, as long as you get adequate NREM sleep. So again, if you fall asleep during this presentation, maybe you'll learn something. So actually, the other thing to think about with this is, a lot of people like to cram, students cram the night before for tests. They stay up till 3 a.m. cramming for the exam the next day. Well, that doesn't actually work. If we go back to the sleep cycles, most of the NREM sleep is in the first half of the night. So if you're staying up till 3 a.m., you're only getting the REM sleep, and you're not getting that memory filing. So better to get the sleep. Other thing that it does is also it improves your ability to forget, which may not seem important, but it is, because you don't want to remember every single little detail of everything that you learned that day. And your brain is actually quite good at picking and choosing what to remember and what to forget. They've actually done studies where they say, they test people before they fall asleep, and they say, remember these things and forget these things. And then the brain actually does a very good job with it if they, better when you sleep than if you didn't sleep and tried to remember and forget them. So, it also improves your skill memory. So playing the piano, playing any sort of motor skills. This chart over here shows the chance of injury, percentage chance of injury, and how much sleep you get per night. And so you can see less sleep, a lot higher chance of injury, which makes sense. If you're not sleeping, you're not coordinating your muscles as well, and you might get your leg into the wrong position or aren't able to react as quickly. So, anybody ever heard of Tom Brady? Yeah. So he actually is kind of notorious because he would sleep 9 hours a night throughout his career, and he was able to play, basically as long as anybody has in the NFL till 45 and a half. Now he was protected by the referees a lot, but I digress. So yeah, actually the NREM sleep is also increased with infants when they're learning to walk, which again makes sense. They're learning new motor skills, they're learning how to walk. So what about REM sleep? So REM sleep, from what I just said, it might be like, oh, why do we even need other types of sleep? That's all we need to do is learn new memories and things like that. So REM sleep is your dream sleep. This is when you're dreaming, which is why typically if you're sleeping in a little bit, you wake up and you're waking up from a dream. More that happens later in the night. Main two things that the REM sleep does is it helps you process emotions. So this is obviously quite important because we are very social creatures. We live in a world where we have to interact with other people. It also is the same type of thing, previous day's experiences. So that's important because if you were to remember, if you think about memories in the past, usually you remember emotions. Oh, that made me happy, that made me sad, that made me a lot of grief, that made me nervous. And so when you recall those things, if your brain did not damp down those emotions, then you would have those same emotions resurface every time you thought of something, and you would be an emotional wreck. Actually, a lot of mental health illnesses like schizophrenia and other things don't have as good of REM sleep, and so they aren't able to. The emotions become overpowering in some ways. And so that's for the previous day's experiences, but also for the next day interactions. So if you have a good night of sleep, and then next day you're involved with a family member, you're better able to interpret their body language. You're better able to interpret their meaning. And so instead of, you can see these different facial expressions up here. For instance, say this one, you might think that was disgust when it's actually confusion. So it helps you basically interact better. So it's really important just for our social interaction and how we process our emotions. Makes it easier to get along with people. And I guess this is also intuitive. Everybody knows that, my wife knows that if I am going on little sleep, I'm a little harder to deal with. So it also consolidates your memories. I would say this is, so not so much as in filing them, but synthesizing them. So this is when your brain is also becoming creative. So it is looking for what kind of connections between this thing over here and this thing over here, this interaction here, this fact over here. This is what you see with infants when they're really learning grammar. We don't teach infants, okay, what's a subject and what's a noun, what's a verb. They just pick it up instinctively, and that's because their brain is doing this. Who's ever heard the term, just sleep on it? Yeah, so you've got a big decision to make, just sleep on it. There is actually a lot of good evidence that is a good idea because your brain, there have been multiple huge discoveries and epiphanies and things that happen just from a good night's sleep. The periodic table of elements, so that would be the organization pattern of all of our different elements that we have, all the different minerals that we have. So reportedly the scientist that worked on it for 3.5 years, could not figure out how it was organized. He one time reportedly stayed up for 3 days and then got a night's sleep after that, and then immediately woke up and he said, this is how it is, and it's only been one thing has been changed since then. So yeah, we got the two different types of sleep, and both are equally important for different things. So benefits of sleep. I probably don't need to go too much into this, but improved circulation, decreased heart attacks, proper metabolism, so decreased risk of diabetes, immune system function. immune system is just better when you have slept. Actually, they've done studies on like the flu vaccine. If you get a good night's sleep for a few days and then get the flu vaccine, your body responds to that better than if you didn't. So cancer preventative, prevents brain fog, fatigue. Obviously, you're more awake and alert. So it actually does heal the brain. There's decreased risk of Alzheimer's, kind of what we talked about earlier with the lymphatic drainage. Improved memory. So yeah, of course, same type of thing. When restoring memories from short-term to long-term, then that's going to help. Actually regulates your hormones and fertility. Aids mental health. We talked about that, especially the processing and regulating emotions. It also improves your creativity. Kind of talked about that, and actually decreases pain sensitivity. Now, who knows who this picture is? Who's that supposed to be? Sleeping Beauty. Yeah. So you've heard of your beauty sleep. That's actually true as well. So they've done studies where they had a well-rested group of people and a non-well-rested group of people, and had people rate their attractiveness. I don't know if I would, the ethicality of that study, but and they found that the people who had slept well were actually more attractive than the ones who weren't. So, what happens if we don't sleep? Well, everybody knows everything is worse when you don't sleep. That's again intuitive. Everybody knows that. So sleep deprivation. So this is different than insomnia. We'll get into insomnia in a little bit. But sleep deprivation is intentionally depriving yourself of sleep even though you have the adequate time. So this would be due to different factors. Work, obviously that can do it. Home life, entertainment, again the binge watching if you're staying up late watching TV shows, or medical issues. Again, this is different than other medical issues, but when you have the adequate time but you just aren't allowing yourself to sleep. Okay, another quiz question. What's the world record for time staying awake? Anybody shout it out?
5 days.
5 days? Anybody else? I need 2 more guesses. 10 days, okay. 7. So 10 is the winner as far as being closest. 19 days. So Robert McDonald in 1986, 453 hours and 40 minutes. Well, I should say that he probably did actually sleep during that as far as what they call micro sleeps, which is kind of what happens when you fall asleep at the wheel where you just sleep for like 3 seconds, but they didn't count that. So the Guinness Book of World Records actually stopped recording sleep deprivation due to harmful health effects. Because it can lead to psychosis and things like that. You can actually have hallucinations, and I should say that that is the longest recorded time to talk about how bad it is for sleep deprivation. Obviously, all the things that we talked about in the previous slide, those things are the opposite if you're not sleeping. But even they use, a lot of countries and terrorist organizations will use sleep deprivation as a form of torture. So I've been reading about it in like the Gulag Archipelago. Soviet Russia was doing this to their prisoners quite often. And so it's possible that somebody actually was awake for longer than 19 days, but that's the longest on record. So problems with lack of sleep. Again, we just talked about that, basically the opposite of all the good things, so increased risk of cancer, increased risk of diabetes, decreased immune system, etc. Some of these statistics we talked about already, the 50 to 70 million people with the chronic or ongoing sleep disorders. The main thing with this page would be about 300,000 car crashes happen every year due to sleep deprivation. We often talk about drunk driving. It's actually far more common to have accidents due to drowsy driving. So it's unfortunate that we didn't do this presentation a month ago because that was Drowsy Driving Awareness Week. I guess we'll celebrate it this week instead. This chart is just looking at the odds of getting in a car crash based on how much sleep. So at the bottom you can see this is 6 to 7 hours, this is 5 to 6 hours, 4 to 5, and less than 4. So, and that's compared to 7+ hours. So you have almost a 12 times increased risk of getting in an accident if you have less than 4 hours of sleep, and even twice the risk of getting in an accident if you have 5 to 6.
Excuse me, how did they get those statistics? Ask the people that have been in an accident?
So for this one, it was actually, they studied some data from 2005 to 2007 based on EMS calls. And so I suppose, yeah, they would just ask the person, how much did you sleep the night before? I don't think they don't, we got all this new technology that we can monitor people's sleep, so I don't think it was anything with that, but, so I'm sure it's just a survey. And actually, so there was another study too. They looked at 4 different groups of people. So one group got 8 hours of sleep the night before. Another group got 8 hours of sleep, and they got them drunk to the legal limit. Then another group had 4 hours of sleep, and then another group had 4 hours with the alcohol involvement. And they found that compared to the 8 hours of sleep without the alcohol, they both, the 4 hours of sleep and the 8 hours with alcohol, were 6 times more likely to make mistakes in a simulator. The ones who had 4 hours of sleep with alcohol were 20 times more likely. But it's interesting that the sleep deprivation was the same as those who were drunk. So a couple common concerns with sleep, probably the most common ones that we see. So sleep apnea. Usually it's obstructive sleep apnea. So what happens is essentially you have either a different shape of your mouth, your jaw, your neck, extra tissue. As you fall asleep, those postural muscles all relax. All the muscles relax, and your airway goes from a nice tube to flattens. It gets blocked. When that happens, your oxygen starts to go down, and your body says, hey, wait a second, we need oxygen. So it half wakes you up. It doesn't usually fully wake you up. It kind of half wakes you up. So you do this kind of half asleep, and then would half wake up, then half asleep, then half wake up. You're not getting into the good sleep cycles that you need. And so it can lead to non-restorative sleep. So you feel more tired throughout the day, more unrefreshed. Usually some symptoms of it are loud snoring, some pauses when you're breathing while you sleep, daytime sleepiness, some morning headaches, frequent nighttime urination. Also there's some other ones. But you get a lot of health problems with that. So a lot of issues with the heart, increased risk of stroke, diabetes, basically all the things that we talked about that are beneficial. Again, you're not getting the good sleep cycles. You're not going to have as good of the memories. You're not going to have the restoration, the clearing of the toxins from your brain. It's diagnosed with a sleep study. So if you do have concerns with this, then I would say talk to your doctor about that. Treatment is a couple different options. Oral airway device, where they put a little device in, almost like a retainer that can help hold the mouth open a certain way. Weight loss, again, if you have a lot of extra tissue around your neck, losing that extra weight won't collapse the airway. The mainstay of treatment is the CPAP. That's what's the machine up here. There's different types of machines, so you don't need to be intimidated by it. But basically that forces air in to pop that tube open so it stays open. I have a lot of patients who say, oh, I couldn't wear a mask, but then once they do and once they get used to it, they're like, I don't know how I slept without it. So, and then there's some different surgeries that you can do as well. So what about insomnia? This would be another common cause of poor sleep. So insomnia is different than sleep deprivation because you have, so it's difficulty falling asleep, difficulty staying asleep, waking too early, can't fall back asleep, or you just have poor quality sleep. And this is different than deprivation because you actually do have the time. You should be able to sleep long enough. So this can be due to a lot of different factors. So it's kind of hard to parse it out with just a big overview, but it can be due to medications, it can be due to drugs, it can be due to different behaviors, it can be due to different medical conditions or diseases. Also adjustments, so think about if you had a job change or a loss of a loved one, obviously that can affect your sleep. Or idiopathic. Idiopathic basically means we don't know why, so we're not smart enough to figure it out. Anyways. So treatment of it is a couple different things. So there are sleeping pills. I'll get into talking about that a little bit. Other sleep aids. Cognitive behavioral therapy. It sounds like a fancy word, or a couple words. Basically, it's doing some different techniques that can help your body to get into that rhythm of sleep. So that can be things like sleep deprivation, where you say, okay, I'm not going to fall asleep until this time. Some sleep hygiene practices, which I'll talk about in a little bit too. Oftentimes it's working with a therapist or somebody who's a sleep therapist to kind of troubleshoot and talk about what are the different problems that you in particular are having. Actually, I think I did talk to Amanda, counselor for the hospital here, and she does do some of this, so it does some techniques with it. So that might be something to look into if you're interested. So a little big slide with a lot of different things to talk, or a little slide with a lot of things to talk about. Does this help with my sleep? First one's kind of a trick question, because caffeine, does anyone who wants to say that caffeine helps with their sleep? Okay, I've heard of people that say they drink a cup of coffee before bed and that helps them fall asleep, but I don't know about that. So caffeine is interesting. It's not so much going to help people sleep, but they say it helps me stay awake the next day. Caffeine is basically it's a chemical that's in coffee, chocolate, a lot of soda pops. Essentially, what caffeine does and why it helps you stay awake is you have another chemical or hormone, or it's just a chemical called adenosine. Adenosine builds up in your brain throughout the course of the day. So as the day goes on, it goes up to the point where it hits a certain point and you say, oh wow, I'm sleepy. And so when you fall asleep and your body gets rid of that. And so it kind of does this whole cycle of building up. What caffeine does is it blocks the adenosine. So you block it, you don't feel tired until that caffeine wears off. Caffeine's half-life, which means how fast it's degraded in your body, is about 6 hours. So if you have a cup of coffee at noon, it's like you had a half a cup of coffee at 6 p.m. When that caffeine wears off, that adenosine has continued to build up, and that's where you get the crash. So if you had caffeine, it puts it off for a little while, but once the caffeine's out of your system, their adenosine is so high that you just feel so tired. So the issue with caffeine is people often say, well, either you have it too late in the day or you have too much of it. So if you have a cup of coffee with supper at 6 p.m., that's like you had a half a cup of coffee at midnight. And so a lot of people have sleep issues because that caffeine is still in their system. So they're lying awake like that previous picture, wide awake, and why am I not tired? It's midnight. Well, because you still got caffeine blocking your sleepy chemical in your brain. And then what happens is the next day, you didn't get good sleep, so you have a cup of coffee in the morning to get you jump started. Well, then you get back into the same cycle because now you're not getting that sleep, and then the caffeine is keeping you awake the next day, and it gets to be this whole cycle. So that's the issue with caffeine. Alcohol. I'm not going to ask who drinks alcohol to help them fall asleep tonight, at bedtime. But a lot of people say, "Oh yeah, I have a glass of wine before bed, and it really helps me sleep." The issue with that is. Going back to the sleep cycles, alcohol is a very good sedative where it makes you feel sleepy, it relaxes you, but it doesn't allow your brain to get into those sleep cycles. So you're really not getting the restorative sleep that you need if you drink alcohol before bed. So it's not a good sleep aid. Sleeping pills, there are a whole host of sleeping pills. There's different classes, so these are some common ones that I put up there: Ambien, Lunesta, benzodiazepines like lorazepam, antihistamines, those would be like the Tylenol PMs, and the Benadryl, doxylamine, or Unisom. They all work in different ways. Two issues I have with them. So one is they shouldn't be used for long term because they can be addicting, where you kind of get stuck on needing to use them to fall asleep. And then two, they kind of do the same thing as alcohol. They don't really let you get into the good, deep, restorative sleep. Now, there probably is a use for these, so if you're on these, don't freak out and try to stop them. Talk to your doctor about that if you have issues. In my mind, some sleep is better than no sleep, so if that's the alternative, then that's okay too. It's just probably not as good as some other ways to help you sleep. What about melatonin? Is melatonin good for your sleep? Well, so the answer is it's complicated. Yes, it is in some sense, but as far as a sleep aid to take every night, it probably isn't as effective. Now, if you take melatonin every night and you feel like you're sleeping fine, that's okay. It's probably not unsafe, but it's probably only good for shift work or jet lag and things like that. Melatonin is your hormone that your brain makes every 24 hours, kind of helps regulate your sleep cycles, builds up towards bedtime. So when you go to bed, melatonin is high. So that's the idea. You take it and it kind of starts your sleepiness. So it's very good for if you stayed up, if you get jet lag, if you travel to Europe and you're 6, 7, 8 hours difference, start taking melatonin. It'll help you shift better. It's also good for shift work, so if you have to work a couple of nights in a row and then your body gets all thrown off, it helps you get reset onto that normal cycle. Magnesium, I've heard of a lot of people say, oh, magnesium for sleep, and that's kind of a hot thing right now. Does it help? I would say actually probably, depending on the form you take and how you take it. And it's probably overall safe. Now you'll know if you take too much magnesium, because we use that for cleanouts before colonoscopies. So you'll know. But I have had some people that have taken magnesium actually topically, like lotion or cream or oil, and say, you know what, I sleep really well when I do that. I think there is some evidence that magnesium can be helpful with sleep. Again, it's probably overall safe. So that's, again, if you have questions, you can actually talk to your doctor about it, but I've seen some good results with that. It's not been very many people, so I don't want to, again, promise a magic bullet or anything like that that's going to knock you out. So how about supplements? There's a lot of different supplements that people claim can help with sleep. Valerian root, hops, I won't even read all of them. Cannabis, is that what Dr. Wilson talked about last time, I think? Oh, it wasn't, okay. I thought you talked about that. Anyways, so that's not one that I necessarily recommend either, but the harder you work during the day, the more tired you are at night, but not too close to bed. If you're too close to bed, then your body is still stimulated. Avoiding caffeine and nicotine, I know that's like a curse word to say avoid caffeine, but that may be a problem if you're having trouble sleeping. Again, not all of these are going to be particular to each person here, but these are just different tips. Avoiding alcohol before bed, again, not getting the restorative sleep that you need. Avoiding large meals and beverages late at night. Avoiding medications that disrupt sleep. Some of that can't be helped, so I'm going to talk to your doctor if you have concerns. Don't nap after 3 p.m. You got that sleepy hormone that builds up throughout the day. If you nap, it brings it back down, so then you won't be able to fall asleep at night as easily. Do something relaxing before bed. So rather than watching a World War II movie right before bed, that's stimulating, that's going to wake you up, or watching election results or something like that. Do something that's relaxing, reading a book or just quiet, taking a hot bath or shower. What that does is it relaxes you, but it also, with the temperature, it cools you off. So as that water evaporates off your skin, it cools your body temperature down, and so then you kind of have that simulating that coolness of the nighttime. Again, dark, cool, screen for your room, basically simulating those sleeping conditions. Get adequate light exposure during the day, so if you don't get the right light, then your brain isn't telling you to wake up during the day, and then it confuses that rhythm. So it's important to get it's hard this time of year, but getting that light, especially, sometimes what I see is that people will not sleep well, so they get up early, they get up at 4 a.m., and then they say, well, I need to do my exercise, walking is good, so they go out for a walk. Well, they're doing that in the dark, which is good, it's good to exercise, so if that's all you can do, that's good, but it's actually probably better to do it at the peak daylight hours, so 10 o'clock to 2 o'clock, sometime in there, because that will tell your brain, this is daytime, I need to be up now, not nighttime. And then don't lay in bed awake. I would say 20 minutes, then get up and relax. Do something relaxing. Go sit in a chair, read a book, go take a shower or something that's relaxing. If sleep is mostly psychological, so if you are laying in bed and you're frustrated, I'm not sleeping, why am I not sleeping? Your anxious thoughts, everything is going. You're training your brain to do that when you're in bed. And so take a break, get up, go do something else, relaxing for a little bit, let yourself get tired again, then go back to bed. So those are just some different tips. That's about all I have. If are there any questions?
Yes.
Yes.
How do you get back to sleep when you wake up 3 o'clock in the morning, go to the bathroom, go back to bed, and straight get back to sleep?
Good question. So you could.
Breathing techniques or anything?
There are some breathing techniques. So there's something called 4-7-8 breathing, which does have some evidence to it. And actually, it's probably more for anxieties. So you get up and okay, all of a sudden my brain is awake and it starts racing through all the different things I have to worry about and don't have to worry about, but choose to worry about, or that pop into your mind. And so 4-7-8 breathing. Basically, what it is it's a cycle of breathing. So without getting too sciencey, your vagus nerve is a nerve that comes from your brain and it helps control a lot of your automatic body, so your breathing, your heart rate, all those sorts of things. So basically it's a way of tapping into that to say, let's calm the whole body down. So 4-7-8 breathing is essentially, you breathe in over a count of 4, hold your breath for 7, so a count of 7, and then exhale slowly, a count of 8. And I would do about 5 cycles of that. So it's something that might feel kind of weird the first time you do it, the first couple of times you do it, but if you stick with it and kind of practice with it, I've heard of a lot of people saying this just puts you right back to sleep when you have an issue like that. So that would be one thing you can try. I mean, the goal is obviously to keep the sleep going. If it is more of a urinary problem, again, it could be a sleep apnea, it could be, getting up to the middle of the night is not uncommon. It could be related to sleep apnea, it could be some other issue as well, so you can talk to your doctor about that too.
Would you repeat those again, please?
The 4-7-8 breathing, or the,
What you should do,
Oh.
yeah.
well, I said,
Breathe in and then,
yeah, so the 4-7-8 breathing is 4 seconds breathing in, breathing through your nose, and then hold or not 4 seconds, but count of 4. So I can demonstrate here in a little bit too. So count of 4 breathing in, holding your breath for the count of 7, and then exhaling through your mouth for the count of 8. So I can't say I'm a pro at this either, but to demonstrate it would be like this. Something of that nature. There's probably YouTube videos you could look up online, and if you got the ability to do that. These are some good resources for other sleep topics and issues. So if you have any other questions, yes.
So, you've had a fairly good day, you've been on pain meds. You're caught up when you go to bed, you've had your pain meds, your limit for the day, you've done your melatonin. You either lay down and you're in pain, or you sleep a little bit and then you wake up in pain, and it's more than a 10. What do you do?
Talk to your doctor. The question was, yeah, and that is a good point, because how does pain play into it? A lot of times that's the reason for waking up. Again, I don't know that I have a magic bullet to fix everything. I think that's part of the reason for some of the new stuff with that I think that transcranial electrical stimulation will be helpful. Yeah, there's other factors besides just, hey, you're not a good sleeper. There's pain, there's the anxieties of the day, there's other medical conditions, there's other medications. So I don't know that there's a perfect fix for everyone here. I wish I did have that, but yeah, pain. So pain would be, that's kind of a catch-22, because maybe you saw it on the slide, but yeah, it increases pain if you don't sleep well. Well, then also if you're not sleeping well, you have increased pain, and vice versa. So yeah, I don't know that I have a good answer necessarily. Yeah, I don't have a great answer for a specific instance like that. So, other questions? And back.
I've read that if you give your children melatonin and you do it regularly, then your brain won't remember to create it on its own. Is there any truth to that?
Possibly. So the question was, if you take melatonin all the time, does your brain kind of not make it on your own? And that would be probably the main concern I would have with taking it every night. So that's why it's probably best used kind of periodically, 1 or 2 nights in a row, get you back on that schedule. Now I don't know if I have read any studies particularly saying that, but it would make sense with other types of hormones. When you take them from a pill form, then your body says, well, what do I need to make this for? It gets kind of lazy. So yeah, I don't know of any particular studies that show that, but that would make sense to me. Okay. Any more questions? Good. Well, thank you everyone for coming. Hopefully everybody got something out of it at least that can help.
thank you.